Good afternoon, my name is Michael Martin. I'm an MSW student at Savannah State University. Today I'm going to talk about the CSWE Educational Policy Accreditation Standards, or the EPOS, specifically Competency 7, which is the assessment of individual families, groups, organizations, and communities. So what are the EPAS? Council on Social Work Education uses the Educational Policy and Accreditation Standards, or EPOS, to accredit bachelor and master level social work programs. The EPOS also establishes thresholds for professional competence for students and social workers in the field of practice. Why are the competencies of the CSWE so important to social work? It's a great question. These competencies encompass abilities that integrate and apply social work knowledge, values, and skills in the field of practice in order to promote client well-being. Competencies are measurable practices that standardize integrity, quality, and excellence in the social work profession. CSWE defines 9 competencies. Again, we'll be discussing competency 7, which is the assessment competency specifically. So what does the concept of assessment mean to you?
It means the process that we go through with a client to get information from them, which generally happens at the beginning of the client or relationship, I would say.
That's a great answer. Let's listen to what Dr. Ford has to say about assessment and its importance.
Beverly, could you talk a little bit about the purpose and the value of the assessment process?
Assessment seems to me to be the key element of good process. It's the one that if I have a choice, that if I've got limited time, it's the one that I'm going to devote some time to, because it's the place where I get to initially engage the client in the process. It is the one where I think I'll get the kind of information from the client that will enable me to use what I call ammunition. Ammunition to get them engaged and ammunition to keep them engaged.
So that's a great definition. Ammunition or information to keep them engaged, and we're able to do further engagement to help build our intervention strategy. So according to CSWE, assessment means the collecting and organizing of data from client interviewing and applying critical thinking to the data that we obtain. Critical thinking means, according to the definition that we just read, understanding the knowledge that we gain not solely due to human behavior, but human behavior within the dynamics of social environments, and filtering all this information through established multidisciplinary theoretical frameworks leading to the analysis of client data. The assessment then leads to the generating of a mutually agreed upon intervention goal based on client dialogue concerning their strengths, their needs, and their challenges. This is very important because as we interview our clients, we want to know what strengths they have that they're bringing to the situation, what needs that they're facing, and what challenges are actually preventing them from meeting their needs. This will help us build our intervention strategy. Clients and social workers then select a treatment strategy based on obtaining client buy-in. That's super important because of self-determination, and ensuring the unattainable interventions are not created. Because anytime we create an intervention that actually doesn't work because we've not identified properly the strengths or the needs or the challenges, it just creates frustration, which is the opposite of what we're trying to establish with well-being in our clients. So what's the big deal overall about assessments? The assessment drives the intervention that we create as social workers, and that's super important. As social workers, we understand that a poorly performed assessment will create an ineffective intervention plan, which is the opposite of what we want to do with our clients. There's a note here that assessment is always an ongoing component of what we're doing as social workers, and that's because new assessment data will inform the intervention plan and make it more effective for achieving the goals established for our clients. So in summary, assessment is perhaps the key component for creating client intervention strategies, as it represents the initial knowledge foundation upon which all preceding interventions are built. An accurate assessment is also crucial for understanding client strengths, needs, and challenges, which are critical for designing client buy-in within the resultant intervention plan.
Mm-hmm.
So do you have any questions today about the CSWE competencies, especially competency number 7?
So what would you say are some type of assessments that social workers do?
Well, I personally now in field am using a biosocial psycho analysis or assessment, and there's also a behavioral analysis or assessment tool that I use as well. Did you learn anything new? Was the presentation engaging?
I feel like I really enjoyed the video component that you added because I liked her perspective a lot. I like Dr. Ford's perspective. And then I think that the way you talked about the information really aided in the understanding overall.
Thank you for that. Well, was there anything that I could have changed, like my gestures, my tone?
I think that maybe making the presentation itself a little easier to read would have been helpful, just because the background's a little light and it kind of makes it a little hard to get some of that information. But that's really the only thing. Other than that, it was really great.
Well, thank you very much for your time and attention, and I've enjoyed being a presenter to you today about Competency 7.
All right. Well, thank you.
Thank you.
That was perfect on the time.